Hello, John. It's good to see you today. If you recall, in the past few sessions, we selected a few tests for you to take in order for us to learn a little bit more about the reasons you decided to seek counseling. These tests were selected because they're all considered to be reliable and valid in measuring the areas in which you're currently experiencing your present difficulty. This information will help us to make an outline of how you're feeling and what it is that we can do together in our sessions to work on your problems. It's not a rush to label you with any form of diagnoses. We genuinely care about your health and well-being, and we want this environment to be a supportive environment in which we can work on some of your problems, okay? Now, I can assure you that these results were calculated in accordance to the directions that accompany the testing manuals for each individual test. No one besides my supervisor and myself have seen these results. They're always kept locked in a cabinet in a secure location in our facility, and they're not shared with anyone outside of the realms of your original confidentiality agreement that you signed when you began seeking services with us. Okay? Now, like I said, you did take 4 tests: the Beck Depression Inventory, the Beck Hopelessness Scale, the Beck Scale for Suicide Ideation, and the Beck Anxiety Inventory, which are some of the most trusted psychological instruments. Those are just instruments that measure thoughts, feelings, and things that bring people to therapy. Like I said, these tools are reliable, valid, and they aid me and they help me figure out how to work with you in our process here. Okay? Now, are you ready to hear your results? All right. Well, your score on the Beck Depression Inventory indicates that you're at risk, that you're at severe risk for depression. Now, the Beck scale for suicide ideation, your scores on that measure also indicate a moderate risk for depression, as does your scores on the Beck Hopelessness Scale. Okay. Now, the Beck Anxiety Inventory reveals that you're experiencing some very troubling physical symptoms in addition to your other symptoms, such as your feelings of helplessness and hopelessness and depression and anxiety. Okay. When we take all of these assessment results and we put them together, they indicate potential diagnosis for depression, which is helpful because it helps us figure out where we need to go in working in our sessions together. Okay, I think for our future plan, we're going to focus on your feelings of depression, hopelessness, and anxiety towards the future in our future sessions. However, one of the items you selected in your Beck Depression Inventory, which said, "I would kill myself if I had a chance," makes me very concerned about your risk for suicide right now. So let's take the rest of the time left to us in the session and let's talk about some of your feelings and your thoughts about suicide, okay?